Joining us now, Alfredo Ortiz. He is the president and CEO of the Job Creators Network, and they've been fighting the battle here. You know, when the whole socialism thing started, people like me didn't take it seriously. And I remember talking to Alfredo months ago, and I'm like, you know, why are we even covering this? Because, I mean, does anybody really believe this stuff? This is like, you know, fringe crackpot stuff. And he's like, no, we got poll numbers, John. We got poll numbers showing that 50% of the country's millennials believe the United States should be a socialistic state. And I'm like, you got to be kidding me. So he was right. He nailed that, as he nails everything. And he is with us now. Alfredo, great to have you with us, man.
Hey, John, good morning. Great to be on once again. It's been a while, so it's good to hear your voice.
I know, because you're so busy. Now, are you going to the re-election announcement, Alfredo, in Orlando?
You know, I am not, but a good friend of yours as well, and our Chief Communications Officer and President of our foundation, Elaine Parker, is going to be there, so you should make sure to connect with her.
I'm going to do that. I'm going to do that now and be sure that I get her on live. I'm on till noon, so I got an extra 2 hours, so she doesn't have to get up at 5 a.m. and come be on my show. She'll have a little bit of time to get there when you got to go in person.
Well, she'll enjoy that, I'm sure. And no, it's going to be an exciting day, and I think I'm sure we'll hear some great stuff from the president.
You did an op-ed the other day in The Hill with Dr. Tom Price, former Secretary HEW. You said that Democrats constantly overlook conservative solutions to fix our broken healthcare system. I guess we're so jaded by this whole thing now that we don't really think there is a solution, many of us, having gone through the repeal and replace nonsense where basically the Republicans raised money, lied, and had no plan. When you say there's some conservative solutions to fix it, Alfredo, can you run through with us what some of those might be as you outline in your op-ed?
Yeah, and what I want to do, John, though, is first kind of take a step back, because when you look at what they're trying to do currently with this Medicare for All, I want to make sure that everybody understands that what they're trying to do is paint it with a bunch of different names and a bunch of different things and, you know, try to make it sound better than it is, right? But at the end, you know, it's whether it's called universal health care coverage or single payer or Medicare for All, the result is still the same. It's socialized health care and the elimination of private health insurance for nearly 200 million Americans. That is really fundamentally the plan. So in the end, when you look at what they're trying to recommend, you're going to be end up paying more, waiting longer, and getting less. I mean, it is basically what they're recommending is the VA system on steroids. And that's one of the most ridiculous things that we would ever want. And we know that Americans don't want that, right? What they do want is they want that choice, right? They want transparency. Right. We know that, you know, some of the fixes that are currently in place with HHS right now, you know, coming at through executive orders and through the direction of President Trump, in terms of dealing with the, you know, soaring healthcare costs. I mean, when you look at these middlemen, you know, they're called PBMs, pharmacy benefit managers. I mean, it's like a $180 billion industry that was basically created to create these middlemen. And, you know, when you look at some of the soaring healthcare costs, and especially on the prescription drug costs, a lot of that is related to the way the whole, you know, mechanism really works or really isn't working. And so we already know that President Trump is addressing some of these, especially on the prescription side. But what we really need to do is go back to the fundamentals of what America wants, right? And what do the people want? Because I think, John, what has happened, and frankly, I think probably both sides would be, I'd say, are kind of guilty of this right now, is that it's become the politician's plan, right? Whether it's on the left or on the right. We just need to ask, what do the people actually want? That's one of the big failures, I think, of Obamacare is that it has, you know, it prescribes basically a one-size-fits-all solution for America, and I don't think that's right, and I don't think that works for our American system. And so that's one of the things I think the Republican plans are going to be looking at is really being able to offer that kind of freedom of choice to be able to choose the kind of plans that you really do want, not the ones that politicians want.
But how does that bring down costs? Because that's really the issue. I mean, it's not that you don't have access. If you have the money, you have the access to whatever care you want right now, because it's not rationed. And so if I feel like paying $2,500 a month, you know, I'm going to get the Cadillac version. I can't do that. I have to pay $500, so I get bare bones, right? because that's all our family can afford now. So my question to you is, how does that bring down costs and make it more available to a bigger pool of people? That's my question.
Yeah, so John, I think that's one of the biggest questions right now that they do have to actually answer on this one, which is the specifics on that cost part. But it is through competition overall. And what has happened, if you look at the two biggest systems in our country that have probably been able to enjoy the least amount of competition or free enterprise, it's our education system and our healthcare system.
Right.
And because of that, you just have these rising costs. I mean, when you have allowed, if you look at, for example, LASIK surgery, I think this is a good example. And
that's a great example.
Some people
go ahead.
Out there would probably be able to understand that, right? It's kind of an analog here, is that before it used to be like $2,000, $3,000 per eye, right? Now you can get that pretty much about $1,000 for both eyes. And that's because the free enterprise market system has actually entered that particular market and allowed for competition to actually happen. In the healthcare market, and again, I mentioned education, but we'll talk about that for another day, we really haven't allowed that. Obamacare hasn't allowed that. I mean, one of the things that was going to help, for example, small business owners, which is who we really fight for out there, are association health plans. And that was introduced through executive order through the Department of Labor. But unfortunately, in March, a band of Democrat attorney generals got together and basically sued the government because they said they were trying to circumvent, Obamacare. And so it's been stopped. But that was going to help small business owners be able to actually afford, because of that competition, where you could cross state lines, where you could, join together and basically kind of create this idea of a co-op, basically to bring down some of these costs. So you can create that competition. That thing has been stopped. And so one of the things, John, that we're saying is that, you know what, there was something that just passed Congress almost unanimously, which is unbelievable, on association retirement plans to allow competition to happen to help these small business owners have retirement accounts that are more cost effective. Why not allow for that same kind of competition to happen for these association health plans and allow that competition to drive those costs down? So, we're saying, let's go ahead and introduce legislation. Let's not leave it for the courts anymore. We have to do this. Almost 10 million small business owners had to drop their coverage for employees because they just couldn't afford it anymore because the cost kept going up and up and up.
If people have the ability to shop for health care across state lines, this has been one of the things that many of our callers have asked for, Alfredo, for a long time. Why can't if I'm in New Jersey, why can't I go to Connecticut or Montana, right, as an example?
Right.
Just like we can buy car insurance. I mean, when I first got my driver's license or permit, or I guess license in New Jersey, I was 17. So this was 1974. That shows how old I am. And you had to get insurance, and it was mandated, and it was only in New Jersey. So rates were higher because you couldn't go out of the state. Now you can get Geico in 15 minutes or whatever, Progressive, anywhere, and it brought it down. How would being able to eliminate the state barriers bring costs down? Walk us through that, Alfredo.
Yeah, I mean, John, it's exactly what you just described. I mean, it's literally what people are benefiting from and experience when they're buying auto insurance, for example. You're able to create competition. We know that in our free market system, competition in anything will drive costs down because you're that's a limited dollar, right? So a person has to be able to decide. I mean, if you look at, for example, air travel, right? The more competition you have in air travel, the more airfares go down. I mean, we've been there when there only basically were three carriers, right? And prices went up. And as competition expanded, the prices come down. And so, again, I use kind of LASIK surgery as one of those things. I mean, look at what competition has done there. Even, plastic surgery, cosmetic surgery. I mean, the more competition that's been allowed, the more the prices come down. And it's a simple concept, really. But the problem is that you got the insurance regulators in many cases, and these democratically controlled, legislative bodies, states, that don't want to see that kind of power because that's what would happen, right? If they all of a sudden start allowing, the state, for insurance to be sold across state lines, you've got insurance regulators start losing that power, right? So again, some of these bureaucrats are really holding back
Right.
The ability for some of that to happen. But we should be embracing this kind of competition because it is going to be something that's really going to be helpful. And quite frankly, one of the things that we're going to be recommending and we're looking at, because we want to provide some thoughts as well. As you know, John, we have thoughts on a lot of things, and this is going to be one of the areas we're going to be talking about later on this year, is to really be able to have that portability of insurance as well, because I think even on private insurance, there are 180 million Americans that benefit from insurance through their employers. There should be, we think, an element of portability that enables people to take it with them versus having to be dependent on the employer. I think that's a really important aspect of it. Mm-hmm. And hopefully that's something that Congress can look at as one of the solutions, specifically, obviously, on the Republican plan, because that's definitely not included as part of Medicare for All.
So, Alfredo, when you talk about portability, you're talking about, if I could draw an example and understand it, much like, remember 401ks when they first started, you leave your company and you could, it was a hassle to take them, and so it kept people from leaving. So what you want to do is, if I want to go from job A to job B because I can get a promotion or something or a better job, or just I want to do it, you want people to be able to take their health coverage with them. Is that the concept?
That's right, John. And your example was spot on from that perspective. That is exactly what I think would be helpful, right? So instead of it being employer sponsored from that perspective, where if you do leave that job, you lose that insurance piece, allow that to be portable, right? Which basically means then the consumer, the patient, can shop that around, right, and allow the dollar to be used basically as leverage to compete, to have others compete for that dollar. Again, we talked about auto insurance. I mean, that's basically what happens, right? So it's driving costs down through competition. We know that this is something that works. Whenever you introduce competition into anything, it will drive prices down because people want, there's only that $1, right? So you got to compete for that $1, and whoever has the better plan, the better service, better coverage is going to win. And so that is actually a good thing for America and for patients across the country.
You're on the John Fredericks Radio Network, trucking the truth across America. I'm your Godzilla of the Truth. I'm live in Washington, D.C. We're with Alfredo Ortiz. He is the president and chief executive officer of Job Creators Network. More information, go to jobcreatorsnetwork.com, jobcreatorsnetwork.com. They're fighting the battle every day against socialism. One more quick question. I've been very intrigued by satellite or by internet, where you can actually have an appointment with a doctor on a Skype.
Telemedicine.
Telemedicine. I'm sorry. I couldn't think of the word. Telemedicine.
No problem.
What is your position on that?
I think it's awesome, John. Telemedicine, I think, has to be integrated into every single plan, would be my perspective, because it's something that allows. Look, first of all, America's on the go, right? We're on the go all the time now. And, to be able to then take, time of your schedule. I mean, look at you. I mean, you're either on the radio, you're doing something. I mean, imagine, for example, during a break or after, that you could actually effectively beam into your doctor, whether it's through your iPhone, your iPad, or whether it's, through, online, but that you can actually have that kind of care that takes place that's convenient for you. Imagine all the Uber drivers, for example, and Lyft drivers that are out there constantly on the road. When do they have time to be able to go to the doctors, right, and make the appointments and sit there for 45 minutes, an hour in the waiting room? Imagine if they could literally just call in through their phones. They call their doctors. They give them kind of basically, here's what's going on. Here's my kind of overall diagnosis, and then through that, the doctors that come in through the telemedicine can maybe prescribe medication or tell them what's possibly going on, or say, you know what, this is probably a little bit more advanced than we could probably take on right now, so let's go ahead and get you over to the doctor, right? I mean, this is actually something that I'm surprised that we have not adopted as a country years and years ago, and that it's still something that people are kind of toying with. This is a no-brainer to me.
Yeah, I think it is too. And I was just thinking the other day, we were talking about it in covering the Virginia legislature next year. And I believe in going to the doctor. I know a lot of guys don't. I mean, I'd like to go to my doctor. He's a fun guy, and he tells me I have to lose weight, and he's been saying that forever. I don't. But I just don't have time. Like, I don't have 3 hours to just go. I'm on the road, or I got something to do. And I would love to be able to just plug in at 10 a.m. when I get off the air and talk about some of the issues. And look, he's going to tell me if I need to get in there or not, but maybe not. We can just have a conversation about some of the stuff going on, and he can tell me certain things. So I love the idea. But
Yeah.
look, I'm running out of time, but I've got to get to this. You had a press release the other day, Alfredo, about universal health coverage. And what nobody's talking about is the fact that 230 million people have private insurance. I mean, does Bernie Sanders and Elizabeth Warren and Joe Biden, did they really want to tell 230 million people in America, you're losing your coverage, you have to do what we say? I mean, is this even a serious discussion?
Well, John, so, again, that's what the crazy part, right? I mean, it is going to be over 200 million Americans potentially would be told you can no longer have your insurance through your employer. People have to understand that is the actual policy that's being proposed by Bernie Sanders and AOC and all the other radical socialist left Democrats that are out there. But I also want conservatives to focus on is what is really kind of considered the Biden plan, right? And the left is saying, oh, that's not enough. It doesn't go far enough. Well, look, I'm concerned about the Biden plan because it's going to be positioned as something that looks like a good compromise in the end. But again, it's still what we're talking about. It's still that single payer idea, or they call it kind of like the Medicare buy-in, which allows the age to come lower and you can buy into the plan. It's still leading all towards where the Democrats want to do, which is a single payer plan. And we know that as a system, as an idea, the single payer plan idea just doesn't work. Look at Canada. Look at the UK. I mean, in Canada, for example, you have about 1 million people on wait lists for health care issues. That would be translated to the U.S. to about 10 million people if we were to kind of extrapolate out. In the U.K., the number is 4.1 million. If we extrapolate that number to the U.S., it would be like 20 million Americans waiting on wait lists for health care. So this just doesn't work. This kind of socialized medicine controlled by government just doesn't work, and we know that. We do not need the VA system on steroids. And that's the concern here, John, and that's why we're fighting this.
Well, you guys are doing a phenomenal job, and you're one of the lonely voices out there because we have had this discussion, Alfredo, so many times. I mean, Republicans in Congress are very timid, and they're always playing defense. You play offense, and that's why I love having you guys on. And I'm really excited about Elaine getting up early in Orlando and coming live on her Radio Row. I know she's going to do it. I'm going to inspire her to do that. And I want to thank you for being on today. Elaine, you got to come. Look, I don't want to be there all by myself, Elaine, at 5 a.m. Come on, man. Come on, you got to come.
Hey, you know what? You should have her on the show the whole time.
She should co-host with me. That's what I'm talking about. Yeah,
exactly.
she'd be great.
Exactly. She'll love you for that.
No, it'll probably be the opposite, but I'm gonna find a way to get her there. Elaine, if you're listening to us now, come with me. You can co-host the show. We'll have so much fun. We're on 6 hours. Plus, 2 is better than 1. Right? 6 hours is a long time. You got to go to the bathroom, get coffee, right? A lot of things going on. John Fredericks Radio Network. Alfredo, thanks for being with us, man. Job Creators Network. Go to jobcreatorsnetwork.com.